Welcome to this podcast. My name is Adam Fiore. I'm a teacher and clinical supervisor at the Montreal Institute of Classical Homeopathy, also known as MICH, or the acronym MICH. And at MICH, I run clinical focus sessions that bring hands-on and experiential apprenticeship to our students and interns. And we're able to share expertise that enables students to address the dynamic root of disease and allows the use of the ideal homeopathic similimum to bring homeopathy to its full potential as an energy medicine. MICH is a fully accredited homeopathic program, and it's deeply grounded in a truly holistic framework. Find out more and get access to free homeopathic training webinars on our website, www.michmontreal.com. So once again, www.michmontreal.com. So thanks for tuning in today and listening. I'll touch on the topic of trauma and also some of the contemporary maps that MICH has integrated into our approach, including the map presented by Dr. Rajan Sankaran. So I'll speak about the delusion level and vital sensation, some of the opportunities and challenges. I'll also speak of some examples from the plant kingdom and also touch on the bird group of homeopathic remedies. So all of this will be in the context of some key homeopathic contemporary maps, which MICH has integrated into a whole system of holistic understanding. As mentioned, the vital sensation approach, which many of you will be familiar with thanks to the pioneering work of Rajan Sankaran. So I'll discuss that a little bit. As well, we utilize in great detail the contemporary maps and understandings of other wonderful homeopaths, such as Jan Scholten, Dr. Joshi's, Manesh Gandhi, and others. And these are examples of maps which bring a holistic and system-based understanding. And the system-based understanding complements the foundation of homeopathic, individualized, classical, symptom-based prescribing. So the word trauma has definitely come into popular use, and I hesitated to emphasize this language. And yet, upon further reflection and looking at a lot of the cases that I work with and see anyhow, most contemporary homeopathic approaches, including the method that we use at MICH, lead to a deep and thorough exploration of a patient's inner landscape, including unintegrated life experiences. So in many complex or chronic type of situations, these unintegrated life experiences that come up in case taking quite naturally because they are looking to be seen and heard and healed, brought to wholeness, will quite easily touch on frozen and stuck experiences, sometimes referred to as inner wounds. And these frozen or stuck experiences need care. And there can be a lot of emotional pain held at the level of the body and somatic energetic states and vital sensations that benefit from not only the homeopathic presence and awareness that we bring as homeopaths, but as homeopaths have known from the start, when necessary, the homeopathic similimum helps to release the vital force's full healing capacities. And as we know from cases that we have in our practices, of course, when clients heal, they all speak of a renewed sense of optimism, a renewed sense of hope, of possibilities, and from that, a renewed sense of purpose and meaning. And this is a very important direction of cure when we hear this in the follow-ups. So coming back to maybe the challenges that might come up and the opportunities, of course, when using the vital sensation and the sensation method is sometimes listening for what the vital sensation is. We'll often hear many expressions and sensations that relate to defenses. A lot of expressions of tension or restriction in the body. And sometimes these can be accompanied by body gestures or hand gestures, of course. But these are often related to mechanisms that help protect from or to not actually fully feel. So they are reflective of important evolutionary protective mechanisms, but not the actual vital sensation. So I wanted to speak a little bit about how do we know the difference. So as we all know from our own experience, when the body is reacting from fear, it constricts, it gets tight, it gets tense. And all different energetic medicines have pointed to this. So the flow of energy in the body is compromised. So how do we access and help somebody get in touch with what their whole organism is not allowing them to seemingly get in touch with? And so often what happens in case taking is when we come to the delusion level, which we should mention is, of course, not in the present moment. The delusion level is the homeopathic language, if you will, for something that's not actually happening. It's not in the present moment. It's not in the here and now, and it's based in fear. So we know we can land on the delusion level very easily in case taking. For example, the fear to be attacked, the fear to be bankrupt, the fear to be kidnapped. But to elicit exactly what the vital sensation is, that can be a bit of a challenge. So one of the things that is helpful to remember is that the vital sensation, and for example, I'll use the plant kingdom specifically here, the vital sensation in the plants is something that cannot be, it's as if it's something that cannot be felt, it cannot be re-experienced. So it's as if that energetic emotional wound or energetic emotional sensation is to be avoided at all costs. It's as if one's survival is based on not experiencing that sensation. So again, an interesting sort of conundrum. We're trying to elicit something that the patient's whole organism feels it can't integrate or it can't adapt to. And of course, this is largely unconscious to them. So hence the necessity of the homeopathic process and the homeopathic remedy to help the organism integrate the experience on an immaterial level. And of course, the physiological, psychological, emotional levels all shift, but it's really on the immaterial level that the vital sensation becomes most clear. And so with the plants, one of the things that's really helped me is to remember that it's as if their survival is to not allow the vital sensation to ever be felt or integrated. So furthermore, the vital sensation can be understood as being unbearable to the person. So this requires certain case-taking techniques which uh, which sort of need, if you will, a kind of a dancing or a holding with the expected compensations and instinctive defense mechanisms that we expect given the above context. And so when we are speaking about something that was traumatic in the past, in a case-taking context, we know that it's not literally happening now. For example, if there was some type of violence that the person experienced in the past that they were never able to fully integrate, regardless of many of the different modalities they may have used to great effect, but there's still, the experience still has a hold on the organism in some way. So we need to be sensitive and in tune with where the client is in the present moment during the case taking. And this is the basis of a trauma-informed or trauma-sensitive understanding as a practitioner. And we also at the same time are open and curious and really listening from a transpersonal perspective and allowing a hearing, if you will, of how their body remembers what happened as a vital sensation. So once again, it's less about what literally happened and much more an individualized understanding of how the whole organism is holding that experience energetically. Now, of course, in homeopathic practice, the etiology cannot be overlooked. It's an essential part of a symptom-based totality. And sometimes the etiology in and of itself, for example, ongoing abuse or violence or something of that nature, can point us through certain keynotes and etiologies to different remedy groups. For example, the nosolicinum, for example. But we're not clear on how the person experienced it in an individualized way until we hold the space to listen without prejudice. So once again, this is part of the challenge, but also the wonderful opportunity of homeopathy. If we can hear clearly what the person feels, they can't feel. So in many ways, a big part of case taking is to delicately, if you will, or with sensitivity, explore that aspect. And of course, if we can hear that vital sensation in all areas of the client's experience, all areas of their life, if it's global, especially in seemingly unrelated areas over the course of their whole life, then we're really hearing the immaterial pattern. And it's that immaterial pattern, that immaterial distress pattern, that's really looking for the information it needs to come into healing or to come into wholeness. So let me try and ground this with an example. I was working with somebody who was experiencing crippling panic attacks for over 15 years, and these panic attacks would send them to the hospital time and again, only to be sent home. Uh, and, obviously having done a full checkup and being told that there was nothing happening, that it was in their minds, if you will. And in speaking to this person, they expressed with incredible precision, I would say, the context of when the anxiety started. And so I'll quote what this person shared. It all started when my dad got sick. He had a bypass surgery and his health declined rapidly. He was all tied up and he had tubes all over him. And that is when the anxiety first started. That traumatized me. It went right into my head. When I saw him like that, I got so scared. He was so dependent. End quote. So these 5 or 6 sentences really, uh, there's a whole tapestry of understanding to explore. And that's what we did. We explored the client's relationship with his dad. We explored his own instinctive inner stress responses, of course, his vital sensation. We explored the avoidance, which is a big theme in this person's life of being dependent and being tied up and needing to ensure that their freedom was maintained at all times. So to be dependent and tied up was an unbearable thought. We also explored the clients where their focus and energies are in their life, in their work, what their highest capacity is, where they feel challenged, where they feel confident, etc. And all of this, along, of course, with the classical basis of symptom totality. And the plant remedy that was chosen was a very well-known one, which is Cactus grandiflorus. And for almost 2 years, the client experienced much amelioration. And as we often see in cases, this particular client was very self-aware, was using many meditative and spiritual practices and many different other approaches, had a really impeccable, I would say, lifestyle and diet. But none of those supports, which are all wonderful, of course, were able to really bring the message to on a deeper level. But as is the case with life and healing, At different times, things need to change. So after about 2 years, a second remedy was chosen. There were some things that kept coming back. So I didn't go too far. Everything still pointed, if you will, to the same plant group, the same vital sensation as the Cactaceae family, as per the Sankaran approach of the sensation method. And in that approach, in the tubercular miasm, the plant remedy Sirius bonplandi was suggested and really brought wonderful long-term lasting results. As mentioned, this is a plant remedy from the Cactaceae group, and it's often an essential drug differential in heart complaints, which was also a big part of this client's picture. And recently I taught an in-depth webinar on the bird remedies, the homeopathic remedies from the bird kingdom. And many of the masters have discussed differential remedy groups for the birds. One example being the Felidae group that corresponds very well to the birds of prey or the raptors. So the wild cats that correspond to um, the raptors, such as the eagle and the hawk, etc. And the lanthanides are another example. But more recently, Dr. Sankaran has published the superclass theory, and once again, this has continued to push our understanding. So for those of you who may not be familiar with this newest advancement in terms of the sensation method, I'll simplify things here by saying that the cactus group and the birds have a lot in common. So it could be that in some cases, as I've seen a number of times now, that we may start with one and move to the other. Now, obviously, this is always context. We need the larger context of the case. But I'll give you one example where a Rumex, the plant remedy Rumex, which many of us know for those sort of tickling sensations and in the back of the throat. So a Rumex plant presentation, for example, might benefit from a bird remedy to continue the client's healing journey. So I've seen Rumex, and this is a remedy which is actually found in the same what's called the subclass, same grouping as the Cactaceae family, and which is known as the Caryophyllidae group. So subclass 3, as it's known, is the Caryophyllidae group, which contains the Cactaceae group and other groups. And Rumex I found to correspond to the mountain bluebird, which is a lesser known bird remedy. And so it's these types of larger correspondences and really amazing advancements, I would say, that help us to be much more precise and to follow somebody's healing path over time. So there's just maybe one other topic that I wanted to touch on today. Hopefully it will be of interest and relates to what I've mentioned before, and that being spiritual bypassing. So spiritual bypassing. So I first came across this term many years ago in my own spiritual work, in books by the Buddhist teacher and psychotherapist whose name is John Wellwood. And I was reading some books about, he has some well-known books around relationships and spiritual practice. And it always stuck with me. And then as the years went by, spiritual bypassing became a term that's been used by many teachers in many contexts. And I'd say it holds an important teaching for many homeopaths to be aware of. Because there's many seekers, spiritual seekers, or people who are invested in learning about themselves, who come into the homeopath's office. It's seen as a safe space, a holistic space, a space where their freedom of health will be honored. So, spiritual bypassing, specifically in brief, refers to using the use of spirituality or spiritual terms and concepts to bypass or avoid unintegrated patterns of stress. So basically, of course, we all do this as human beings, I would say, but we bypass what we can't adapt to. And with spiritual bypassing, we bypass what we can't adapt to with these spiritual teachings or ideals or beliefs. So this can be a range of experiences that are being bypassed. Of course, traumatic experiences being one of them. Traumatic stress, deep chronic stress, early childhood experiences, which were very difficult. But it also includes bypassing areas of our development or evolutionary development that we've sort of been unable to grow and that we've sort of stagnated around, if you will. So the Caryophyllidae plant subclass, as mentioned, the bird remedies, and even the lanthanides are all looking or striving for a sense of freedom, different flavors of freedom, but some sense of freedom and space and expansion in their experience. And so clients who benefit from these remedies might be strongly influenced by spiritual teachings, and often those that are based or interpreted, possibly we could say, on absolutes as such as emptiness and oneness and states of bliss, where there's no duality. Now, of course, there's no judgment whatsoever about any of this, but in terms of one's healing path, curiosity emerges. Some of the questions that we might ask if somebody has a strong spiritual inclination is what does spirituality help superficially remove in that person's experience? We might ask them for examples that examples of what on this earth in everyday life experience, if you will, what is rooted in instinctive fear. And so often the spiritual bypassing creates a distance and sort of a shutting down and a numbing out and a false sense of protection, if you will, from instinctive fear and those deeper stress patterns. And of course, we need to know in using the maps that I've discussed, what's the vital sensation? What's the vital dynamic? We might also ask, what did they experience before they found spirituality? Maybe that's a simple way to think about it. In other words, what was their experience of the world? And what was their experience of the world that they had a very difficult time feeling or accepting or allowing? What do they feel should not be in the world? And of course, as homeopaths, we know that this would be a core susceptibility. And in terms of the plants, as mentioned, they definitely do not want to ever feel that vital sensation again. It is unbearable. And they feel helpless and powerless. It's as if they cannot integrate it. So the what, it can be an event, it can be an object, an experience, but the what that they are affected or overwhelmed by, this will be on the delusion level. And then the instinctive reaction and sensation is actually the unintegrated energetic pattern. Now, the good news in all of this is that that energetic pattern, if you will, that unintegrated experience is waiting to be integrated. It's waiting to be felt and seen and helps the actually the optimal energy of the person. It comes to a higher level, of course, because the vital force, once it receives the correct homeopathic similimum, is liberated. So one last example, the remedy anilonium. Now, this is a drug-like remedy, and it's also found in the cactus group, the Cactaceae group, which, as mentioned, is in that third plant subclass, the Caryophyllidae. Now, the main sensitivity is that their identity is being limited or restricted. And so, by leaving the body and floating, if you will, into one's mind or consciousness, the person may use spiritual practices to access these out-of-body states, which are expansive and without any restriction. So these states of oneness have no restriction and are expansive, but they come at the cost of being chronically in opposition to life in the present moment. And it will often be seen that the person feels that they can't stay in the present moment safely when there's a backdrop of traumatic stress. So, spirituality in this context is protective and it separates instead of uh, bringing awakening and transforming what needs to be healed. So anhelonium and similar homeopathic remedies can help the person feel what they can't and to do so safely and, as we know in homeopathy, gently. So I hope you enjoyed this presentation that inspired some ideas, some different ways of thinking. And as mentioned, if you'd like to view the bird webinar, which is really an advanced and in-depth exploration of the bird kingdom and homeopathy, you're welcome to sign up now. It's available on webinars.michmontreal.com. So the word webinars.michmontreal.com. It's really perfect for students in training and practicing homeopaths. You can access the webinar and learn how to use these wonderful bird remedies and also look at some of the differentials, some of the ones I mentioned today and others. And then you'll be able to have a further experience of the MICH method, which shows us how to effectively support complex case histories and, when necessary, histories that have a traumatic stress or trauma background as well. So once again, that's webinars.michmontreal.com. And thank you so much for listening. Have a great day.